You may not have noticed, but there are now new rules for how nutrition is labeled on food. Nicole Ford has a breakdown of the changes and the reasons why.
When you pick up an item at the store, you might not always look at the nutrition label.
There are some people that have to look at the labels because they might have health issues. Perhaps they have diabetes, perhaps they have heart disease, and so there are certain things about that label that they really should pay attention to and keep track of.
The labels break down what's in your product, but it's not always easy to understand. The FDA added some new requirements starting in 2020.
So in some cases, when it's a bottle or a bag, you'll see what the serving is, and then you'll see what the whole bag is, so you can decide, do I want to have that or not?
The reason behind the changes is to give you, the consumer, an accurate reflection of what and how much you are eating.
But I think the more we know, the better we do. Does it always translate to us eating less? No, but at least we're aware of it, and maybe we can start that journey.
Other changes include the elimination of vitamin C and A with the addition of potassium and vitamin D. Doctors say that's because Americans are more likely to have a deficiency in vitamin D. Plus, you'll now see a breakdown in sugars.
When it's added sugar, it might be sugar added to the cereal or a sweetener added to a beverage. Those are the things that are a problem because most of us consume too many of them.
While the FDA already implemented the new requirements, they're working with manufacturers in the first 6 months before they start enforcing the changes. Nicole Ford, KDKA News.